Hi, my name is Martyna Erskine. I'm family nurse practitioner at Joy Wellness Partners. Recently, I've been at the conference in Miami. It's a Lead Dermatology conference, and I learned a little bit more about hair restoration treatment options, and I would love to share them today with you. So let's first talk what is the hair loss. So a medical term for hair loss is alopecia. And alopecia, it can be very, very emotionally traumatic. Our hair status, it's almost seen as our health status. So sometimes when we see an animal, for example, and this animal has patches without hair, or the hair are missing, or the hair are very thin and it's half balding, we think about this animal that it's genetically compromised, that it's weaker, it's worse, and that's sicker, and that's how we see animal with alopecia. And that's exactly the same how people with bad hair feels like, or with balding. So it's really, really emotionally heavy condition. Like I said, it's seen as a health status. A lot of patient reports feeling embarrassed. They avoid social gatherings. They are very afraid of being in a center of attention because of that. They have usually very low self-esteem, and they, in general, feel very unattractive. So there is 3 stages of a hair cycle. First stage, it's an anagen phase. That's the phase when our hair are growing. Lasts around 3 years. In general, around 80 to 90% of our hair is in an anagen phase. And hair usually grows on average at 1 centimeter a month. So this cycle determines the length of our hair. And the next phase is catagen phase. So that's like a transitional phase. This one lasts about 3 weeks. Hair does not grow during that time. And then around 1 to 3% of our hair is in this stage at a time. And then last stage, it's the telogen phase. And telogen phase is like a resting phase. The hair follicle is completely inactive and considered dead. And that can last for about 3 months. And 6 to 8% of our hair, it's in this stage usually. So hair gets smaller, lighter, and falls out briskly when the new hair is growing in. So it's normal to lose around 50 to 100 hair a day. If it's more than that, that's when we consider this as an alopecia. So there are, like you see, different patterns of hair loss and different type of diseases of hair loss. It could be a lot of causes, could be nutritional, hormonal, sometimes often due to autoimmune diseases, and sometimes it can be mechanical. Hair loss blood panel. What we usually want to test in a blood to see what could be a cause for hair loss. Like I said, the causes, there could be around a million different causes, but finding the basics, that's our goal. So first we want to look at the thyroid, because hypothyroidism cause hair loss, as well as the hyperthyroidism can cause a hair loss. So we want to take a look at the thyroid stimulating hormone. We want to look at the free T3 and free T4, which are the hormones of the thyroid. Make sure they're not too low and also not too high, because both of the condition can cause hair loss. The same, we want to look in the anti-TPO, which is antibodies that attack our own thyroid gland, and then a patient have autoimmune thyroid disease called Hashimoto. That could be the reason for hair loss. We want to check DHT, which is dihydrotestosterone. That's the bad testosterone that causes men pattern balding, as well as the acne in females. We want to check the luteinizing hormone. We want to make sure other hormones are within normal limits, like estrogen and testosterone. Other tests we like to check, it's mostly autoimmune panel, like ANA, ESR, HSCRP. Those are elevated. There's a high chances that patient is inflamed, and then patient might have some autoimmune disease. Ferritin, it's like an iron store, active form of iron, and we want to make sure that patient is not deficient in iron, because iron causes anemia, and anemia causes hair loss. The same, we want to see vitamin D because it's very important for hair growth. We want to make sure patients think it's within normal limits. Also, as well, total iron binding capacity is very important, as well as iodine. Iodine play a big part in the thyroid function because we need iodine to make thyroid hormones. And then our basic panels like CBC, complete blood count, to see if patients anemic, maybe I have some infection fighting recently, maybe the platelets are very low, platelets have a lot of growth factors on it. Comprehensive metabolic panel to see patients' kidneys and liver, enzymes, and make sure nothing gets elevated. There's nothing going on metabolically in the body that could cause the hair loss. And last one is hemoglobin A1C, just to make sure diabetes, high sugar level, it's not the cause of the hair loss. So what are the treatments? There's a lot of so many different type of hair loss. I didn't want to go in depth with that because I don't think we are here to diagnose anybody via webinar. I think everybody who has a hair loss should go and see a specialist, like come to our clinic, talk to one of us, and we can evaluate what type of hair loss they have, and it will be the best treatment for them. I just want to give you a couple examples of really good treatments for hair loss. So first one, number one, the most important is diet. A lot of nutrients we get from our diet, and a diet is extremely important for our skin health, hair health, and all organs health. It's greatly influenced the hair condition and alopecia. So, and the negative impact of malnutrition on a hair is already well established. There's a lot of study that proves that diet is number one. So what should we eat? Lean leafy vegetables like kale, spinach, collards. They have a lot of vitamin D, iron, beta-carotene, folate, and vitamin C, and they all help hair grow. And vitamin A also helps our body make sebum, and sebum protects hair by moisturizing scalp and moisturizing hair. Another thing is fatty fish, because they have a lot of omega-3s and they have vitamin D. And the best sources are tuna, mackerel, salmon, and herring. And they're a good source of proteins, selenium, vitamin B vitamins, and they all promote healthy hair growth. And another thing are eggs. So eggs contains a lot of vitamins, mineral, and nutrients related to healthy hair. They are a great source of protein, and we know that low protein diet is very often a cause of hair loss and less hair growth. They also have a biotin, and being low on biotin, it's linked to hair loss as well. They also give us some selenium and zinc. Nuts. So nuts are very nutrient dense, and they have a lot of vitamin E, zinc, potassium, and omega-3 fatty acids. For example, almonds are rich in magnesium, and magnesium protects hair growth and prevents hair damage. We should eat around 7 almonds a day. Walnuts are a rich source of potassium, and they help with regeneration of cells, and we should eat around 2 walnuts a day. Brazil nuts are very rich in zinc and selenium, and those are essential trace elements. We cannot make selenium or zinc, so it's very important to supplement with selenium, zinc, or get it enough sources from food, because those trace elements are important for hair growth, and being low on them may lead to hair loss. Another things are seeds. They, especially like chia seeds, pumpkin seeds, and flax seeds, they supply our body with minerals like phosphorus, calcium, zinc, vitamin E. They're very, very important for hair. And then the last thing are fruits, especially berries and lingonberries and blackberries, as well as cherries and oranges are rich in compounds for healthy hair like vitamin C and antioxidants. And then vitamin C protects our hair follicles from free radicals and help our body absorb iron and make collagen, one of the protein that builds hair and help prevent hair loss. And also it's really good for your skin as well, collagen. So now let's talk about supplements. It's worth considering blood work before going on any supplements to making sure you're not overdoing some of the supplements, because they can bring a lot of side effects. Like, for example, supplementing with too much iodine can be toxic. What's the definition of supplement? There's something like added, like vitamin, mineral, herb, amino acid, or enzyme to your normal diet to treat any deficiencies or low levels. And probiotics also should be considered because gut microbiome can also impact our hair. So ingredients to look at in the supplements. Ashwagandha, it's really good cortisol manager. It's really good adaptogen that helps us protect our body from damaging effect of cortisol and improve stress resistance. It has a lot of steroidal lactones and maybe corticosteroid to modulate cortisol level. Another thing that we want to search in our supplements are astaxanthin. That's a carotenoid from red algae, and it's really, really potent antioxidants. It's apparently 600 times more potent than vitamin D. Marine collagen, it's really good to bolster structure of the hair follicles and helps aging skin. Turmeric, it's anti-inflammatory, antimicrobial, antioxidant, and anti-neoplastic. So it's really good add-on to hair supplements. Another things to look for, it's the red clover. It's really good for you. It's a 5-alpha reductase inhibitor, so inhibits DHT production. Maca root, very great source of vitamin C, copper, iron, calcium. It's also one of the adaptogens, so reduces cortisol. Methylsulfonylmethane, that's a hard one. It's also anti-inflammatory, antioxidant. It's immune function modulator, and a lot of amino acids. So high protein diet like L-cysteine, L-methionine, and taurine really help our keratin for hair synthesis. Piperine, it's something from a black pepper, and it's also 5-alpha reductase, so blocks DHT. And the last, saw palmetto, one of my favorites. That one, it's really good 5-alpha reductase inhibitor that blocks testosterone converting to DHT, so helps with a lot of like androgenic alopecia. Horsetail, it's very popular in Europe, especially in a tea form for hair, because it has silica, and that one is needed to even build the hair. And vitamins like vitamin A, vitamin B, vitamin C, especially B7, biotin, and B3 niacinamides are really good if it comes to bees. And vitamin C, ascorbic acid, vitamin D, E, and also folic acid. And I'll explain you why and how each one of them help with the hair growth. You can guys to read the slides. And then what are the best supplements on market? I think the best one is Nutrafol. We have it here in the clinic. We carry that one. They claim that if you take it for at least 3 months, you will see huge hair improvement. And I see this all the time in my patients and in staff. A huge improvement in the hair growth, has a lot of supplementals, so blocks hormonal related hair loss. Another really good on the markets are Viviscal, Votes, Hair Essentials, Sugar Burger, they're really good. Vegamore Grow, then they have peels and topicals, Hair Hero, and Hair Tamine. Of course, there's so plenty other ones. And the Viviscal, the pro version, it's by prescription. So I'm really open to try it on somebody and prescribe to one of my patients and see what improvement they will notice on that compared to like Nutrafol. So this is just the picture of some of the supplements that are already available in the market that we talk about. And this is our Nutrafol. That's what we carry here in the office. That's what we get really great response. Like you see, there's a couple types. There's a special one for men because men's hormones are different than men. The same, there's women, and there's also woman balance for older women or postmenopausal women that have more tendency to converting that testosterone to DHT. And we also have something for postpartum women to prevent hair loss after having a baby. So Nutrafol, it's clinically very effective formula. It's standardized by optimized ingredients. It's totally free of drugs, hormones, gluten, dairy, shellfish, and artificial additives, so it shouldn't cause any allergies or instant sensitivities. It's physician formulated. Also has a lot of adaptogens, So people usually notice visibly thicker hair volume, fuller scalp coverage, softer, shinier and stronger hair, and also less head shedding. There comes in the pills, you have to take 4 a day. So what are the cool ingredients in the additional in the woman balance? Our maca root, we already talked a little bit about it. We talk about astaxanthin, that it's the most powerful antioxidant, more powerful than vitamin C, and then 550 times greater than green tea. And I don't know how is it compared to our glutathione, because this is apparently the most powerful antioxidant. But I think it's just like it depends on the delivery. Of course, getting glutathione via IV, it's probably like the most powerful option you can receive compared to any oral supplements. And supplemental, like I talk about it blocks DHT, the bad testosterone that causes man balding and acne. And this is just a result. This is just like a study that was published about the efficacy of those supplements in promoting hair growth. And actually, it reported overall 81% increase of hair growth, 84 increased volume, 75.8% people increased scalp coverage, and 81% of people increased amount of new hair. So that's the results from the study. So it's pretty powerful and pretty promising. And now oral medication. So if the supplements and diet doesn't work, we can go to oral medications. And I want to show you why and what mechanism they work mostly on. So like you see, most of the hormones in our body are made out of cholesterol, and then it goes to DHEA, and then testosterone, all the androgens, and then testosterone can convert to estrogen via aromatase enzyme, which we talked a little bit about in the previous testosterone webinars. Aromatase can be blocked too for people that don't want to have estrogen dominance, but we want to focus on this 5-alpha reductase. So that one converts testosterone to DHT, which is the cause of balding, cause of irritability in people, and a cause of acne. So that's like the bad testosterone. So most of those medications work on that 5-alpha reductase enzyme. So one of them is minoxidil. You will see, we'll talk about it as a topical. We'll talk about this medication as an oral, because it can be taken in both ways. Some people do the topical, it's out of the counter. You can buy it in a CVS or in a store. It's vasodilator, so brings more oxygen and blood flow and all the nutrients to the follicles. And it shortens the telogen phase, which is the inactive phase, and lengthens the anagen, the active phase of hair growth. And it's used for many different type of hair loss. And the dose is usually between 0.5 to 5 milligrams, depends on the patient and their size and how bad is their alopecia. Another thing is finasteride. It's very popular. A lot of men take finasteride to prevent the genetic hair balding that when their dad was bald and their grandpa was balding and they know it's coming for them, they start taking finasteride to prevent that, because finasteride is a really powerful DHT blocker. However, it comes with a lot of side effects like erectile dysfunction, which can be really horrible if it comes to quality of life. Also, it can cause infertility, some dizziness, weakness, breast swelling, and breast tenderness. Not everybody has those side effects with finasteride. Some people are on it for years and they love it. The most important is start low and go slow with the dose. Another thing is dutasteride. So it's like a second generation of finasteride. Also, it's a 5-alpha reductase inhibitor, but it's more selective of the type 1 and type 2 isoenzymes. So it shouldn't come with so many side effects because of that. It's more potent and blocks 98% of DHT, while finasteride blocks 70%. So it's definitely more powerful. The dose is similar, 2.5 milligrams and 5 milligrams. Those medications could be given to females, however, not really recommended, not for female in reproductive age. It has the same side effects as finasteride. So a fun fact about the dutasteride, I asked on a conference what they think about injecting, because I know you can inject finasteride or dutasteride intradermally, right under your skin, in your scalp. to kind of prevent that and don't have the systemic effects like erectile dysfunction co-works right there on your scalp. So there are a lot of promising studies about injection of dutasteride to the scalp. However, they're all from Europe, and I think it's not FDA approved in the United States yet. However, if you want to know a little bit more about it, there is a lot of research that was done in Europe with good results. And hormonal therapies. Some people do spironolactone. Unfortunately, spironolactone is DHT blocker, but you have to really be on a high dose of spironolactone to have it work. And so it's a diuretic, so it can cause some electrolyte imbalance and some worsening of renal function and can cause hypotension. Another hormonal therapy is cyproterone acetate. We don't really use it here because it's not available in the United States. Another two things are flutamide and bicalutamide. And those are not really, they're rarely used, maybe because of a lot of side effects on the liver and GI issue, and they have some black box warnings. Okay, what about photomodulation for hair growth? Apparently it does work, depends on the photomodulation, depends on the wavelength and also the time and the power. So not each machine is the same. I know that one works pretty well. Dr. Bauman's has this cap. He gets really great results with that. However, he does it with combination therapy, so with PRP or with some oral supplements. And it doesn't have any side effects. It's very safe, no chemicals, no drugs, and it's very effective as well, and can be used for men and women. So what about topicals? So there's a lot of topicals available, like we have some from Nutrafol, we have some from BioT that really works great. They have different ingredients, but also we have some topicals that can be done in compounding pharmacy by prescription. We can prescribe and we can compound for patients the topical that it's very personalized to them, personalized to what they need and why they're losing their hair. So it's really nice because we can put 4 or 5 ingredients. We can put only 2 ingredients, but in a higher concentration to address patient-specific hair loss. So some ingredients, example that we can put in topicals are progesterone, because progesterone is also good for hair. It's anti-inflammatory, also blocks DHT. We can put minoxidil from 2 to 5%. So this increases the length of anagen phase and increases size of the hair follicle. Latanoprost, that's really good stuff too, that increases hair density, so the hair become like thicker. Do topical spironolactone, we can do finasteride topical. It's way better that do it in topical way than take it orally, because does not cause all the horrible side effects that the oral medication does, like erectile dysfunction and all of that. We can put ketoconazole, it's antifungal, and that may be really good for seborrheic dermatitis or androgenic alopecia, people that have very dry, dandruff skin. That might be very useful. And other things we can add is tretinoin and fluocinolone. So we can totally design topical solution just specifically for you and for your needs. So this is like how the prescription topical look like from Anazo Health. They have different options, like you see, and different concentration. We can pick which concentration we want. If patient wants to go more conservative because it's worried about some side effects or itching or redness of the scalp, then we can do a little bit lower doses. Like you see, some of them have even caffeine because it's stimulant. So we can play with it a lot. You can also order personalized conditioners and wash for patients that have a specific ingredients that they're looking for. And those cosmetics smell so good. I'm absolutely obsessed with them. What about intradermal injections? Yes, that's like my favorite thing. We do here in the clinic PRP injections. This is when we draw your own blood, we spin it and separate platelets and plasma from the rest of the blood. And platelets contain growth factors and some signaling molecules and some plasma proteins. And it really helps heal any injuries and regrow the cells. And it uses your own natural product from your body. So it's harmless. There's no way of an allergic reaction because it's your own solution. So it reaches the bottom of the hair follicle, stimulate a specialized population of cells named dermal papilla cells, and they play a critical role in hair growth. And then it restores thickness to existing hair and provide natural way to treat the common issue with hair loss. That's one of my favorite. And we can do PRP and peptides. So there are the peptides that could be added to PRP to increase the effect of it. One of the best one is GHK-Cu. That one is specifically used for skin and hair regrowth and promotes activation of wound healing, attracts immune cells. It's also antioxidant and anti-inflammatory. Stimulates collagen, and collagen is important for hair growth as well. And glucosamino-glycan synthesis in skin fibroblasts. That's why it's really good for the skin, and promote blood vessel growth. And another one we can add is thymosin beta-4. There's a couple studies that shown that help regrow hair in addition to PRP. What about exosomes for hair restoration? Yes, we can microneedle exosomes. Exosomes should be used topically only just because of FDA. Good for growing a hair. They're anti-inflammatory. They stimulate hair follicles and trigger new hair growth. We can do microneedling of exosomes into your scalp. We can also microneedle PRP in your scalp and with the peptides, so the therapy can be very personalized. Some people are really afraid of intradermal injections and they will prefer to just do it on their surface via microneedling. Some people, is the procedure painful? It can be, but we have a Pronox, which is like a laughing gas, so we always use for any hair injections because scalp can be very, very sensitive, and people on Pronox don't really feel it and they can tolerate the whole procedure very, very well. And also we put the numbing cream on the scalp to help numb it before the procedure as well, additionally. And there is like a nice study that here that proves that a really improving hair growth, microneedling, and then way better than minoxidil groups. Okay, so conclusion. Very often people ask me, what's the best therapy for me? Because sometimes they will treat the DHT and the hair will get better, but not really. Sometimes they go on a thyroid medication because their thyroid was low and help with her a little bit, but not as much. The best therapy is combination therapy. There's not such a thing like one approach. It's going to fix all the hair issues. I think everybody should be on a hair supplements like Nutrafol. I think if you are balding or have alopecia, PRP should be like the first option. At least 3 treatments, while in between doing topicals and oral. So I think all 3 of them combined together gives us the best results. I don't think anybody should ever do PRP and they just go home and don't follow with any other hair regimen. Okay, so that's it what I have for you today, guys. Thank you so much. Let me know if you have any question in the box. I will stay for a few more minutes to check if there's anything coming. If not, thank you so much for listening to this webinar about hair and hair treatment. My name is Martyna Erskine, and I'm a family nurse practitioner here at Joy Wellness Partners, and I would love to talk to you a little bit more about hair and then personalized treatment just for you in a clinic. You can schedule 15 minutes free consultation over the phone with one of our providers here. Thank you.